Kerala has witnessed Nipah virus for fourth time in a row.
The Nipah virus has affected the state for the fourth time.
In our state in Kerala, what we assume now is there is a direct transmission from the bats to the humans. In future also there is a chance of regional outbreaks of this disease, not only in Kozhikode but everywhere in the country.
With 5 cases of Nipah virus found in Kozhikode, there needs to be a lot of questions that needs to be answered.
Nipah positive ആയിട്ട് സ്ഥിരീകരിച്ചിരിക്കുന്നത് 39 വയസ്സുള്ള ആൾ. അപ്പോൾ അദ്ദേഹത്തിന് സിംറ്റംസ് ഉള്ളതുകൊണ്ടാണ് അദ്ദേഹത്തിന്റെ സാമ്പിൾ പരിശോധിച്ചത്. അതിന്റെ കൺഫർമേറ്ററി ടെസ്റ്റ് നടത്തിയിട്ടുള്ളത്. നമ്മുടെ ഒരു സർവേയുടെ അടിസ്ഥാനത്തിൽ നമ്മൾ കണ്ടെത്തിയത് കൂടിയാണ്. അദ്ദേഹം ആദ്യം ഒരു എപ്പിഡമോളജിക്കൽ ലിങ്ക് ഇല്ല എന്നുള്ള നിലയിൽ അദ്ദേഹം കൂടി അപ്രോച്ച് ചെയ്തിരുന്നു നമ്മുടെ സംവിധാനത്തെ. വ്യക്തമായ കാര്യങ്ങൾ മീറ്റിംഗിന് ശേഷം പറയാം.
This is Dr. Praveen K.S., who is also the member of the KGMI. Sir, now that the Nipah virus has affected the state for the fourth time, how do you look at the current spread and the kind of infection this time, the spread of infection this time as compared to the earlier stages? How dangerous it is, and how people should be, what kind of awareness should be given to the people as far as this?
So most of these emerging human diseases have an animal origin, what we call a zoonotic disease. So that is basically a spillover event. For this regarding Nipah, these large fruit bats, the Pteropus bats are said to be the natural reservoir of this infection. So we have done, the ICMR has done a study after the first Kozhikode outbreak, and they found that at least 25% of the bats they have captured found to harbor this Nipah virus. So from a public health point of view, we must understand that in future also there is a chance of regional outbreaks of this disease, not only in Kozhikode but everywhere in the country, because these fruit bats are distributed all over our country. Right. So the message to the healthcare professionals and also to the public that is there should be a high index of suspicion in all cases of this acute encephalitis syndrome as well as this ARDS or pneumonia, and the Nipah test should be done in all these cases.
Also, sir, now there are 2 index cases that has been found out as per the findings till now. Do you think that it is a direct transmission from the animal to the human being, or has there been any study conducted on that?
No, definitely. Actually, in the first Nipah outbreak, what is documented in history, that is in Malaysia, there was an intermediate host. That is from the reservoir, it's the bats itself, but from the reservoir there was an intermediate host. That pigs was affected. From pigs, humans were affected. Right. After that, in the Bangladeshi as well as in the West Bengal Siliguri outbreak, there is direct transmission from the bats to the humans. Right. In our state in Kerala, what we assume now is there is a direct transmission from the bats to the humans. Yes. But in case of Nipah, the peculiarity of this virus is that this virus is not adapted for a rapid human-to-human transmission or a rapid spread, unlike this COVID or influenza virus. Okay. So what we call the reproduction number or the transmissibility of the virus is very less compared. So the chance of a pandemic potential due to this virus is actually very less compared to other virus like the influenza or the COVID virus. Okay. So
you say that the spread of the virus is comparatively less as compared to other viruses?
Yeah, the spread of the virus is comparatively less compared to other virus. What we call that the reproduction number of the virus is less than 1. That means the one person who is infected will probably infect less than one person. Okay. So the spread of the virus will in fact very less compared to other viruses.
Sir, one question which many medical experts and many common people are asking is that why is it that this virus is found in that particular region? Because if you look at 2018, 19, 21 and now this time around, it is found in that particular area in Kozhikode and Vadagara, that particular zone. What do you think about that? Any particular information on that?
Actually, we don't have a definite data regarding that, because these Pteropus bats or the large fruits bats are found in all places of our country and also the neighboring countries. So the possibility of this virus present in other parts of the world or other parts of the state are also very high. So basically we should have a high index of suspicion, and we should expect regional outbreaks of the disease in other parts of the state also.
Okay, right. And sir, what are the methods through which we can control this now that monoclonal antibodies have been bought any other steps that can be taken to control the spread of this virus?
So basically, the message to the public should be for the initial stages of the disease. The initial stages of this viral infection, it will be similar to other viral infections like influenza or other viral infection. We cannot actually differentiate between these infections in the early stages, especially in the first 2 or 3 days. And what we can do is those who have symptoms like influenza or fevers should self-isolate themselves, and they should avoid going to public places when they are symptomatic, and also the kids should not be sent to school when they are symptomatic. For coming to Nipah, the basic thing is the spread of the virus is more very common when in the later stages of the disease, especially when the patient is in the hospital. So apart from unlike the COVID, the spread is very less or very limited in the early stages of the illness or when the patient is asymptomatic. So the transmission to the public or the other people in the community is very less in case of Nipah. But the negative side is when the patient is sick, when he is in the hospital, the risk of transmission to the close contact or the persons or the close family members who is taking care of the patient, as well as the healthcare professionals, the risk is very high. So that's the problem in the case of Nipah, and the picture is almost similar, and the infectivity is also similar in the last cases in Kerala also.
Kerala has witnessed Nipah virus for 4th time in a row. Remember, 2018, 17 people have lost their life, and later it was reported in 2019, 21, and this time around 2 people have lost their life, and 5 cases of Nipah virus, Nipah positive, has been detected in Kerala, and that too in Kozhikode, where even in 2018, 19 and 21 it was reported in the same place. Now various aspersions and various questions have been raised as far as the source and the spread of Nipah virus in Kozhikode. Many experts are asking as why is it confined only to this particular region and why is it not found in other parts? There are various answers, but as far as the state government and the health department is concerned, all the steps have been taken at this point of time to ensure that this infection or this virus is not spread to other parts. The central government has provided the monoclonal antibodies and also the BSL-3 mobile laboratory to the state of Kerala to ensure that proper surveillance, especially testing, is being conducted on the ground level. As far as Nipah virus is concerned, in Kerala, now 5 cases has been reported now for 3 people who are under treatment, of which a 9-year-old boy is in ventilator. The health minister has clearly said that all of them are stable as of now. The state government is taking all the steps to ensure that the virus does not spread. And also, there are precautions and there are also guidelines that's been put out for the people of Kozhikode. Remember, there are 950 primary and secondary contacts of the victims of Nipah, and also there are 8 panchayats that's been turned into containment zones where there are strict measures in place, also where people are supposed to wear masks, and also only the necessary stationery items, medical shops have been opened. In Trivandrum with Vijay Lal Puduvel, this is Vivek for New Indian.
For such fine news breaks and video features from ground on your mobile phones, don't forget to subscribe to our channel, The New Indian, by clicking on the bell icon. Also, follow us on the social media handles on Instagram, Twitter, Facebook and Coup.